So just over the past couple of days, there's been a lot of news about nursing strikes. And so what I'm seeing in where I'm at here in Nebraska is the nursing shortage. I mean, I get emailed by recruiters. I get calls constantly, text messages. Are you looking for work? We have more travel jobs. I've got, 5,000 travel jobs that I need to fill. And I get like a list, like a laundry list of jobs from states, cities. Where do you want to work? We got a job looking for you. And a lot of nurses are going on strike in a lot of different cities. And I'll link a post talking about that. And of course, for women, it's not so much about the money, but more about the workload. When God created Eve, he made her as a helper. Adam was supposed to shoulder the brunt of the work, but Eve was there as a helper. She was not designed to shoulder the weight of the workload. And in America, as more men walk away, as more men don't get involved in relationships, as less men are pushed into the workforce because of ideologies, women will be forced to take up a higher portion of the workload. And what I'm seeing here and what I've seen in state after state is all the women say the same thing, that they want to quit. They want to quit. They want to go part-time. I was talking about this literally just 2 days ago, where both nurses and nurses' aides are constantly complaining about the shortages of staff, that now we're taking care of 7 patients on another floor. They're taking care of 8 to 10. And we'll talk about why they're taking care of 8 to 10. And so a lot of these women are like, I'm going to go part-time. I'm going to go part-time, end of this year. And I'm telling them like, hey, we got a shortage. You can't go part-time. All you're going to do is exacerbate the problems. We need you to work more. And these ladies are like, nope, I'm not doing it. And a lot of the people who work in healthcare are old. You have a lot of boomers that over the next couple of years are going to be retiring, not just in nursing, not just in medical field, but in all fields, not just in healthcare, in all fields. You have the largest demographic that is going to be, retiring, that has retired, early retired, etc. And it's going to cause shortages. There's only so many, people you can pull from the southern border that are just basically unskilled labor. You can pull people to sweep floors but a lot of these people are not skilled labor coming through Mexico. Most of those people are happy in Mexico. They're like, I don't want to come to America. They're happy where they're at. So they'll go over there. They'll still stay there. The people that we're getting are the poor and the unskilled. And so you can't fill your ranks with people like that. You're not going to be able to fill, your engineers, your technical jobs are not going to get fulfilled. And so there's going to be a massive shortage. And so when that happens, you'll see the healthcare in America, of course, will continue to spiral down. I mean, currently, we're seeing, there was actually a recent article from the hospital where I work at here, talking about why we're seeing excess wait times in the ER, because there's no beds. There's no available beds. And then on top of that, you don't have enough staff to cover your beds. So most of these patients are just sitting in the ER waiting for a bed. On the other end of the spectrum, we have patients that are elderly that need to be discharged, but there's no nursing facility. There's no skilled nursing facility that can take them. There's no rehab facility that can take them. Or sometimes, because there's such a plethora of patients that are in need of long-term care or intermediate care, that the nursing facilities can be a little bit more choosy about who they want to take. This person might be a little too heavy. This person is going to be a little too costly for what the government is willing to pay us. They're going to eat up too much resources. You got somebody else? And so what's happening, which is what's happening in the hospital where I'm at, and this is a huge hospital here for this, for the state of Nebraska, that they're forced to stay in the hospital. Some of these patients are here 6, 9 months, close to a year in a hospital bed, to the point where, like I was saying before, that they're having to switch dynamics where you're having hospital nurses working in essence as nursing home nurses, where they're taking care of 8 patients during the daytime or 10 patients at night on what are now these geriatric long-term care units because there's nobody willing to take those patients. Either the nursing home facilities are filled, they don't have staff, or they don't want those patients. So they're forced to stay in the hospital for what they refer to as discharge planning issues. And those patients will just sit in the hospital. So now I do wonder if the government is now paying hospital rates for what should be nursing home patients. And it's going to continue in this way, especially as, like I said before, where, the saying is, when the going gets tough, right? The tough get going. That's not going to be the case in these fields that are predominantly manned by women, because the women will quit. We already see it in with doctors. 50% of doctors are women, and they're quitting in droves, or they're going part-time, especially after they get pregnant. They don't want to work. A lot of these women don't want to work. And so all it's going to do is cause more and more shortages in healthcare. So you better take care of yourself. You better mind your health, because you might need a bed in a hospital and there might not be one waiting for you. You might need a nurse and there might not be one there to take care of you. So you better take care of yourself, because the government is not going to be able to do it. And this is the tail end of what happens in socialism. As more people realize, shit, I can sit at home and the government's going to pay me. I can pretend to be part of a protected group. I'm a man, but I want to be a woman because I don't want to bear the load. And the government, in essence, sponsors this stuff. This is what you get. People realize, I don't have to work. I'll eke out the bare minimum. You see this with Native Americans and Black Americans, especially among Black women. But overwhelmingly, you see this very much if you've interacted with the Native American population. They have been decimated in poverty, and it's all related to welfare. When you hand people welfare, it just kills their desire to thrive on their own. Like the Bible says, it is God's gift that people can see good for the hard work that they put in. And so when people don't have to put in hard work, there's no reason for them to thrive. There's no reason for them to excel. They'll live in abstract poverty. I've seen it with my own eyes. It's shocking to witness, but it's true. Same thing happened in Jamestown, where the inhabitants, in essence, voted for socialism that turned into communism, to the point where the people ate their young. They would rather eat their own children than the thought of going back to work. And that's people. And overwhelmingly, that will be women. It will be led by women, as the women who don't want to work are not designed to work, are not designed to shoulder the weight, as they're asked to fulfill roles that typically should be done by men, especially under the weight of a larger, more sick, elderly population. They'll just walk away. And who will be there to care for those people? You already see it in Canada, where Canada is, offering to euthanize, their patients because they can't care for them. You're too costly to care for. What we can offer you is a needle in your arm that'll put you to sleep forever. And I have no doubt something like that will happen, or it'll be, a new pandemic or some sort of bad idea, that will push people over the edge into death. Because it is what it is. This is socialism. This is how socialism ends. It ends in poverty. It ends in death. It ends in food shortages. It ends in worker shortages, what we have in America. But it is what it is. This is what overwhelmingly the people vote for. This is what women vote for, because women are the largest voting bloc in America. And this is what they vote for. If they don't have to work, if the government will sprinkle them with dollars that they print out of thin air, then they will. They will vote for it. They will vote America into abstract poverty. And then, like in Venezuela, they'll pretend like nothing happened. And they'll go right back to the men. They'll go right back to being fit and feminine. And they'll go right back to being prostitutes, which is exactly what happened to most Venezuelan women. They either died off, became prostitutes in Colombia, or prostitutes in their own country, or they went back to the patriarchy. And many of those men died, went to work, scattered throughout nations, looking to find work to survive, to provide for their families. But this is where we're at. I see it as a nurse. I see it among patients. And I see it among the people that realize, I have conversations with my patients. And a lot of people here recognize it. They know what's coming. Well, anyway, I'm going to leave it there. Thanks for watching, and I'll catch you next time.